Hello, I'm Dr. John Kruse, and today is going to be my last talk of the year. And the topic for today is cognitive behavioral therapy, CBT, for ADHD, attention deficit disorder. And as some of my ADHD fans have requested, starting with the bottom line or the take-home message is that CBT measurably can help decrease symptoms and improve both functioning and a sense of well-being in both children and adults with ADHD, but it does take longer and more work than medications. So that's the bottom line. Launching into a bit of backstory, and a lot of this I'm going to be explaining what's my version of how I conceptualize CBT, and part of this is in honor of Aaron Beck. He was a University of Pennsylvania psychiatrist who died at the age of 100 early in November this year. And he pretty much by himself, there are intellectual antecedents, he worked with others, but this was largely his work on developing the practice we commonly call CBT today. He also, if you've ever taken the self-assessment test for depression called the Beck Inventory or the Beck Test, Beck is him. So he was at the University of Pennsylvania in the 1960s, and at that time psychiatry was still dominated by a Freudian psychoanalytic or psychodynamic approach where most of the work was exploring early childhood, figuring out where you developed patterns of behavior, connections to people, images, relationships, how the ego, the superego developed, and therapies were very lengthy and very individualistic without much standardization or consistency. And Aaron Beck was attracted to some of the thoughts both in the progenitors of both cognitive therapy and behavioral therapy, and sort of wound up combining the two over the course of treatment, or over the course of time, developed this, what we call CBT. So CBT is based on a fundamental triad, and that is your brain does three things. Your brain is in charge of all the thoughts you think. Your brain is in charge of all the feelings you feel, so they're not there in your heart, they're really there in your brain, and it's in charge of all your behavior. You can't throw a baseball or get up and make a cup of coffee without the brain being involved. And often when we're sort of superficially thinking about it, we think of feelings, how we feel. If I feel like it, I'll go get a cup of coffee. If I'm angry at someone, I might scream at them. If I'm if I'm resentful at someone, I'm going to think bad thoughts about them. So we think of feeling affecting thoughts and affecting behavior, but one of the insights of CBT is that each leg of this triad, thoughts, feelings, and behaviors, influence each other. So how you think will change how you wind up feeling. How you think about something will change how you wind up acting. How you behave will also wind up changing how you feel about something, and how you behave also changes how you might wind up thinking about something. And again, particularly his focus was on depression in the early days. Most of us don't have direct, immediate control over our feelings. If we could, then depression wouldn't be an issue. You'd just say, think happy thoughts, or feel happy feelings. Just be happy. Just don't be sad. And many people who've been down or depressed have been told, just change your own mood. Just get out of it. So his insights were, again, that if we think differently, if you behave differently, that begins to change how we feel. So also a part of CBT is that we have core beliefs about ourselves, about others, and about the future, and those shape much of our behavior, thoughts, and feelings, and that we are constantly in an internal dialogue with ourselves, sometimes more slightly aware of it than others, where we are giving our assessments of ourselves, of others, of our likelihood of success in this endeavor, of whether this is going to work out, whether it's not, whether I'm going to get distracted while giving a talk. So the approach for changing and working on thoughts. So the CBT has, over time, has a list of classic ways human brains tend to distort thoughts in the same sets of patterns. And so an example of thought distortion is overgeneralization. One bad thing happens to you one day at one place, and you decide everyone hates you. Or mind reading is another thought distortion where you might feel embarrassed in a situation, so you think that everyone is laughing at you or thinking negatively of you, and probably most of them didn't even notice you. There's also black and white thinking where it's either this or it's that, as characterized by much of our politics in this country today. So for each of these thought distortions, and often the name or the title of it, once you're aware of what you're doing, you can figure out what may be a more reasonable approach to reframe some of that information. So instead of, if it's mind reasoning, assuming, no, you actually don't know what other people are thinking unless they explicitly say it or write it or convey it explicitly. And, if you need to know, you can actually ask them. If it's overgeneralizing, it's realizing, no, this was a specific example going on. That doesn't mean that all women are going to treat me that way, or all shopkeepers are going to look at me the same way, or etc. So with the thought distortion, dealing with those, the system is to learn to recognize what you're doing and to learn to sort of reprogram your thoughts. On the behavioral end, CBT deems that we have maladaptive behaviors, and with skills training, with learning what to do when this, rather than when you're feeling down, don't stay in bed, get outside and walk around. If someone gets angry at you and you shout at them in response all the time, that's likely to escalate anger rather than de-escalate it. So you can learn alternative behaviors to replace it. And again, skills training, practicing new behaviors to replace your old ones. So, and changing that internal dialogue. So, for a while, and this was even still going on in the 90s, when early in my training, there was sort of a feeling, we have medications that really address the biological underpinnings of depression, because depression clearly does have some existence in the brain or has some impact on the brain, and maybe this is just sort of another form of talk therapy. It's, again, not the Freudian, why did your mother do X, Y, or Z to you? This is, again, much more looking at the specific in the moment thoughts and behaviors, but still the claim was, well, this is just changing cognitive things, but isn't really changing the brain. And we've had studies now for more than 15 years, starting with depression and panic attack, showing that, so brain imaging studies showing activation of some changes in certain brain regions and brain chemistry when CBT is effective for depression or anxiety. And some of these changes are exactly the same changes that medications have when they're successful for those conditions, and some of the changes that CBT evokes are different than those evoked. So there's an overlapping, a Venn diagram would be some commonality, but some distinct differences that CBT does that the medications actually don't touch. And at least from the depression literature, it's pretty clear that CBT takes substantially longer than medications to work. Once it's working, so of people who it's working for, once you stop treatment and look at people a year after stopping treatment or 5 years after stopping treatment, CBT groups actually tend to do better in the long run than people who've just been treated medication and the medication stopped. So it's suggestive that CBT may actually, I would say we can say pretty declaratively, has more permanent, long, ongoing, meaningful changes in the brain than our medications do for a variety of illnesses. So the nitty-gritty of CBT is there's a lot of introspection needed. So there's a lot of ability to observe what's been going on, and the anchor or cornerstone of much of CBT treatment is keeping records or journaling where when you're feeling sad, when you're feeling anxious, when you're feeling whatever emotion is giving you troubles. You make a record of what situation you're in, what were the antecedents, what were you doing just before this feeling came up, what were you thinking just before that came up, so you can identify patterns that are triggering for you and hopefully, again, develop healthier patterns, either, again, changing those thoughts or behaviors. Sometimes it may involve avoiding certain situations or at least becoming more prepared. But CBT involves lots and lots of observation and lots of homework, lots and lots of practice and repetition, because part of what it's saying is that these distorted thoughts, these maladaptive behaviors are so strong because every day, and largely again at a semi-conscious or not conscious level, we're practicing them over and over and over. You're getting better and better at things that aren't working for you. And it takes a lot of practice to develop new alternatives that can eventually become the new default pattern. So jumping over, again, so CBT originated as treatment for depression. It was extended to a host of anxiety disorders. And then, particularly in the 90s, as people became more aware of, that ADHD isn't just a childhood diagnosis, that it goes on, and some of the medications we use for treating ADHD, even though they have a high success rate, they also have a not inconsequential rate of serious side effects and scare many people away. So there were many people looking for talking therapy approaches to help with ADHD, and there were attempts to use sort of standard off-the-shelf CBT, cognitive behavioral therapy, to treat ADHD. And the early attempts largely weren't that successful because on the surface, it's a horrible mismatch. People with ADHD, and this always sounds pejorative when I say it, so I'm trying not to be pejorative, but measurably we know if you have problems with attention, problems with observing, maintaining concentration on things, your own observations of yourself are going to have more inaccuracies than and none of us are perfect observers of ourselves. You're going to miss more if you're inattentive. You're going to go off more track. You're going to have a more distorted, more inaccurate view of yourself. And yet CBT is based on learning to observe yourself closely and basing all of what follows from those observations that you're making. The other thing that CBT requires is lots and lots of really boring homework and repetition, and that's also a poor match for ADHD people. So it took, and there may have been other groups involved, but I would herald in the early days of this millennium, group at Mount Sinai Hospital, New York, with Mary Salanto at the center of that, and a group, Stephen Safran at Harvard, separately developed very similar manualized approaches for treating ADHD with CBT that tried to compensate for the neurodevelopmental or neuropsychiatric impairments that are part of ADHD that make CBT harder to follow through. So both of those schools have, again, manualized approaches. Salanto's initial approach is teaching particularly skills training and thought distortion unlearning in a group setting. The Safran et al. Group or manual is more designed initially for individual. They can both be modified for either situation. There's certain inefficiency, again, because so many of the thought distortions there's just classic consistent ways human brains distort things. And it can be often more effective or easy in a group seeing someone else who's overgeneralizing. seeing someone else doing their black and white thinking, seeing someone else doing emotional thinking, where, so that's another thought distortion where, I took a test and I feel that I did badly, therefore that means I did badly. So your thoughts, even if you may feel them robustly, you may have, but that doesn't mean that creates the reality of what actually happened. So the center of both of these two CBT for ADHD approaches start with sort of some fundamentals, and they say for everyone with ADHD, you need to have one calendar system. One, you really need to have it because scheduling things, yes, it's the sort of bedrock for successful businessmen or other, scheduling isn't just something people with ADHD need. Everyone's doing it. It's that people with ADHD have problems with time management, problems with organization, problems with getting off track that make it particularly hard to use, and often they'll have multiple calendars, multiple schedulers, multiple lists of what they're trying to get done today. And you need to have one consolidated calendar, and you need to have one task list, and then you need to find a way to get items from the task list to the calendar. So there needs to be a prioritization system. I'll go through a sort of a 2-minute class in 1 minute, and that's prioritizing. Often the effective approach is lump things into 3 categories. The A's are the things that really, really need to happen today. The B's are the things that are important but are less urgent, and the C's are all the other things that need to get done but aren't as urgent. People with ADD, all of us do it sometimes, but often in the urge to finally get something done, someone with ADHD will go buy toothbrushes because I need that, even though mine's not that worn out and I could still keep using it. So at the end of the day, they may have 3 of their C items crossed out, and then the really important one of paying the taxes or moving the car or whatever they need to do didn't get done. So the prioritization is, you need to take care of all the A's before you do any of the B's. You need to take care of the B's before you touch any of the C's. And you need to revise the list on either probably a daily basis or at least weekly, because some of those C items, if they didn't get done, will eventually creep up and become an A in importance. Other parts of CBT for ADHD, other skill sets and other practices are learning how to remove distractions from your environment, learning how to deal with the state of being overwhelmed, which, again, all of us may have at times, but people with ADHD very often have a challenge with emotional regulation, and that can lead to flooding, and distractibility, tracking stimuli can lead to problems there. So there are approaches for increasing attention span. There's approaches for dealing with procrastination. So one other researcher I'll mention, and this is Russell Ramsey, who's at University of Pennsylvania, where Beck spent his whole career, feels that the central, I'm blanking on the term, but that the core belief the central core belief that's detrimental for many people with ADHD in getting things done is that everything needs to be perfect or optimal before I go ahead with it. And this may come from having had failures when, knowing that I'm prone to distraction, I have to have everything free of distractions before I start my work project. So I'll spend an hour arranging papers and then taking stuff to the recycling center. And, so people with ADHD can get fail to initiate because of the sense that everything has to be perfect before they start. And his sort of counter to that is, if it's scheduled, if this is what you plan to do, you pretty much should start it, because if you don't start it, nothing gets done. And if you're waiting for an optimal situation, nothing is an optimal situation. Even if you're the star. We talked about flow last week. The star athlete on 3-point binge or the perfect pitching World Series game or whatever they're doing, even in those situations, everything isn't perfect for them. There's there's obstacles to be met, there's distraction, so part of it is sort of countering the urge, the need to feel that everything has to be perfectly aligned before I can go forward. One other there are a number of self-help books using CBT principles for ADHD. I think a lot of them have great information in them, and I think those, by and large, I'd say they're useless. And that sounds quite contradictory. So again, these principles are good, they're great, they're useful. I work with lots of extremely bright people, extremely motivated people with ADHD. I'm in the heart of San Francisco, edge of Silicon Valley. Lots of people with ADHD, and I have never seen anyone make much use alone of these self-help books. Because what do? They pick up the book and say, oh, that's a great idea. Oh, that's cool. Oh, I'm already doing that one. That one, maybe I should try that technique or that approach. Oh, really good ideas. Put the book aside. Maybe they practice it for a day. Don't get back to the book. Don't stay on track. So part of the CBT for ADHD approaches is it is with a trained person who knows what they're doing in teaching CBT. So one word on that, at least from the depression studies, it hasn't been shown with ADHD, but from the depression studies, rigorous training in CBT correlates with substantially better success than just sort of passing familiarity, or in other words, how rigorously you practice, how rigorously you check up on someone's homework, how rigorously you keep them in track seems to be important. And there's some preliminary evidence from the CBT that sort of how extensively you practice these new techniques and tools that seems to be a predictor for who's going to get good results. I think I am skipping some topic, but I see I'm close to 22 minutes, so I'm going to be ending today, so I won't be here the next 2 weeks, so enjoy the holiday season, however you practice it. I'll be talking about bipolar disorder versus ADHD in the new year, and I'm going to end, if it works, I haven't ended with a song for a long time, but whenever I hear the alphabet soup of CBT for ADD, it just reminds me of Michael Jackson in his younger days singing about ABC. CBT, ADD, that's all. Bye.